We're lucky today to have a special guest with us. Her name is Jen Green. She's a naturopath physician who has a specialty in integrative oncology. So we're gonna pick her brain and we're gonna ask her some questions about an organization she's involved with and also a recent meeting she went to. Now, normally we have a cozy little meeting where we are able to let people speak freely and say whatever they want. But this time I warned you last time and I'm telling you, I'm reminding you again this time, we would like to record this to be able to share on the Cancer Choices website. So if you have any concerns about your privacy, you can turn your camera off and then you'll just show up, your name will just show up, but that's it. And this is going to be us telling you a lot of information. So we probably aren't going to do our usual questions and answers. We'll have a little bit of questions. And Jen is going to give us a nice guided meditation relaxation at the end. So don't say anything really personally, even more so than normal. Any questions need to be general. You remember this is taped, it's going to go on the website. So think about that before you unmute yourself or whatever yourself. So we are in for a real treat today because Jen is one of the best, most knowledgeable and experienced people in the field. So with that, I think we're good. Everybody's okay with this so far? No problems?
Just
Okay.
that I was hoping to be able to ask a very specific couple of questions someplace along the way.
Okay, well, we're not going to do that in any of the part that we're recording, so I'll make you a deal that we'll hear your questions after we stop recording before everybody leaves.
That'd
But
be
if your
helpful. Thank you.
but if your questions are too specific or too personal, we may not be able to answer them anyway. Okay?
General, yeah, not a problem. Thank you.
Okay, all right. So with that, I would like to turn the meeting over to Jen to get started. Dr. Green, thank you very much.
Before we move, could I ask everyone else to turn their mics off?
Off, yeah.
Yeah.
Thank you, Laura. And we have Christine Meinhardt, who's the program director, Laura Pohl, who's the clinical nurse specialist, and the translator for nutrition and cuisine. So actually you've seen her before to do her thing. So okay, everybody settle down. Let's get going. Dr. Green, please.
Wonderful. Thank you so much for having me. I thought I would start by letting everyone know about an exciting project that I'm one of the research directors for, which is called KNOW, K-N-O-W, oncology.org. So KNOW Oncology is in its almost 9th year, which is hard to believe. We are a web-based educational tool for clinicians and cancer advocacy groups and research groups. So it's designed for those and for students as well, I should say, to easily, quickly access human level evidence in integrative oncology. So the way it's basically a database on the back end, we update it quarterly and we use when we search Medline, which is what's in PubMed, if people are familiar with that. But we also search Embase, which is the European and international literature. So our database is larger than just a regular PubMed search because of that. So we have a bunch of studies in there that might have been published in, Japan or India or France that might not necessarily be in PubMed. When we search through all of our criteria, then we collect anything that is a human study on either nutrition or a natural agent and cancer care. And when you go into the website and use it, and there's a 2-week free trial, so everyone's welcome to try it. The other thing I wanted to mention is there's a free newsletter that you can sign up for. We've actually have 2 newsletters now. One is more for clinicians with continuing education and questions to sort of test your knowledge. But the other one is just research updates. And I think this group might be interested in getting that new one. We just started that recently, and those are both free. They come out roughly monthly. So that's an exciting thing that comes out of our, we're searching quarterly, so we're always accessing new and interesting research in the field. The other things to know about Know is that very importantly, that there's a Know provider network. So we have and when you log into Know, there's a tab that says provider network. You can search by location, or you can search by tumor type specialty. It is populated with a mixture of people who use Know. It is voluntary, so not all of the docs who use Know have profiles because they have to upload their photo and put in all their office info. But it is a way for us to try and help people access local care providers who, we can't necessarily say much in terms, there's varied trainings. How much does it cost after the 2-week trial was a question. So it's $260 a year to access it. So save all your questions and search them in the 2-week bit. Or if you're really such a heavy researcher that you want to do that, then absolutely feel free to subscribe as an individual. I'm hearing some background noise.
Yeah.
I
Yes.
wonder where that might be coming from.
Yeah,
Anyways,
everybody be sure you're all muted, please.
what else about Know?
Well, I
So
think it's great to say that Know and Cancer Choices work closely together.
very shared missions
Yep.
of being evidence informed care. So that's what I wanted to say about the provider network is the common thread is that anyone who's bothering to license Know cares enough to be accessing the evidence regularly, and it means they're evidence informed. So that automatically puts them in a certain category of provider, if that makes sense. So while we can't make claims about everyone being X, Y, and Z in the database, we can say that they're using our database and evidence base. So that I think is actually a good criteria by which to consider a provider, because that philosophy is going to be a piece of the pie. So
Excuse me, Jen.
yeah.
I'm searching for how to sign up for the newsletter. I get it, but I don't see it on the website.
It's a pop-up, Laura. So probably because you've already signed up, you're not going to get the pop-up. So when you go on the home page and just move around on it or go to the provider network, the newsletter will pop up.
Okay. Well, they have the link now, so.
Yeah, fantastic.
And just write to Cancer Choices if you have trouble getting it.
Yes.
We'll help you with that. Okay, so that's a really excellent knowledge base and a knowledge source. We share information back and forth. Jen often looks at the things that we write up to see that if she agrees that they're in the right, with all the right information, etc. So, and so Jen, why don't you tell us about the oncology OncANP? And that's the conference you just went to, and I think that's quite interesting. And that's where we're going to pull topics from to talk to you about today.
Yeah, so what we thought is Mary and I were talking about the OncANP conference. So yearly, the Oncology Association of Naturopathic Physicians, which is a very, very active membership group for naturopathic physicians who specialize in oncology, many of whom are board certified, although not necessarily everyone is board certified in that. So this year, our conference was fantastic. So I thought to bring some key highlights from the conference to our discussion today. And I thought it would be neat to pair it with our new Know AI tool. So we just put an AI, well, not fully an AI, to be clear, it's called a Retrieval Augmentation Generation System, a RAG system. But what that means is basically you can talk to it, it accesses a database, and it answers your questions, and it understands it's crazy. I mean, it's really, this is the amazing era that we are living in. The weakness of AI, one of the weaknesses, aside from the fact that it doesn't have any ethics, which is,
Yeah.
in and of itself a problem, but the main weakness is it isn't it's using the web as its source material. Right. So what the KNOW AI is using is just our database. So what that means is if you ask it a question outside the scope of the database, it's not going to be able to answer. So it's only good for asking questions related to natural agents in cancer care or nutrition and cancer care. So that's the limitation. But it also means because it's coming from our discrete data set, the answers are reliable and you can click through to the studies, from the website. So that's all good stuff. And I thought we would pair looking at a new juicy study that we discussed at our conference recently, and then also give it some context because you can do that in a heartbeat, right? What would have taken me, I don't know, 4 hours to prepare for today's session took me 25 minutes because I just asked the No AI some background questions and then we had some context for these studies. So it's a good example of how to use information and how not to get too overwhelmed by the big picture because, once you start drilling down, you can go down lots of rabbit holes and get lost in the research world. All right, Mary, I'm sure that's happened for you.
Sure,
Right?
absolutely, absolutely. And then you're like, kind of, it's late at night and you're going, why is it so dark?
Yes. Maybe it's time to get off the computer. Good. So shall I launch right in with our Silymarin one? What do you think?
That's the first thing we wanted to talk about was milk thistle. And the botanical name is Silymarin marium, which it's interesting. It's almost a weed. It's a nettle. You've seen these things. It kind of looks like it has a big purple thistle flower on top. And if you grab this plant in your hand, it will hurt you. So, but it's a plant that's surprisingly humble, but ends up having this set of chemicals in it that are extremely useful. They're very strong antioxidants, but the reason why I think as oncology professionals we like it is it protects the liver, which often takes a beating during cancer treatment. So tell us about the study, Jen.
Yes, so this was a end of 2024 study looking at combining oral milk thistle with doxorubicin in breast cancer patients. It was a small study, but it was a randomized control trial, so it was a nice, clean design. They used the sort of what's come to become the typical dose, which is 420 milligrams a day, so 143 times daily, although certainly clinically in practice, we also use higher doses without concern. But that was used for 63 days alongside doxorubicin and also cyclophosphamide. And what they discovered is that it was both hepatoprotective, especially for lowering the fatty liver grade, and it also improved certain liver and kidney function tests. And this is now the third study to look at combining. I think you were involved in the first one, Mary, which was the pediatric ALL one, weren't you? Yeah.
No, but I heard about it and I looked
Oh.
at the study design before they used it. So yeah.
Yes, I had it in my head that you were involved.
Yeah.
So this is now the third study to look at combining milk thistle with chemotherapy to show that it is protecting the liver during chemotherapy. And then we also have these other studies in a quick, the AI, overview. What we also have is another kid study or pediatric study where it protected the heart from doxorubicin injury. So protecting the heart is an amazing, amazing superpower of milk thistle, and not one that I would have necessarily expected, but I'm just,
I think that's the antioxidant part. Yeah.
Do you? Yeah. Yeah.
I would imagine that's
yeah. I was a little bit surprised at how much of a difference it really
I
made.
was too. I didn't expect the liver I did, but that I didn't expect. But that was nice for you to get surprised in a good way.
Right. And then we also have a neuropathy one, same dose, 420 milligrams during chemotherapy, reducing peripheral neuropathy. And then we also have same dose, 420 milligrams for reducing radiation-induced mucositis in head and neck cancer. So we now have a bunch of positive trials, all using the same dose, which is kind of handy because often you don't see that. You often have really mixed types and doses. So it's nice to have that consistency. And it's also nice now that we have a fair number of safety studies or pharmacokinetic studies showing that milk thistle doesn't have drug
Don't interact with
interactions.
chemotherapy.
So, you've got incredibly like no risk of harm, an herb that we would use in kids, no problem.
Yep.
And
Yeah.
someone just commented on the chat that taking milk thistle completely got rid of her neuropathy. This is, I think, a new idea that milk thistle will work
Yeah.
on neuropathy. We think of glutamine for neuropathy, we think of fish oil for neuropathy, or B vitamin sometimes, but it is exciting, and I love hearing that you had that experience. And that's consistent with the research that we've seen on it. So it just feels like I think Mary and I are on the same page with this. Low risk
Like
of harm, a number of very
amazing upside.
yes, significant to your quality of life. I mean, neuropathy is often a dose-limiting side effect. Cardiotoxicity is a late effect. So it's working immediately and for delayed issues to really be protective in the liver, the heart, and the nerves.
So,
So,
so
yeah.
here's, see if you think you'd use it this way. You'd say to your oncologist, what are the main areas of toxicity of the treatment I'm going to have? Most of the studies were done with more conventional chemotherapy, the big heavy drugs. And we know some of these side effects occur with some of the immunologics. We'll talk about those in a minute. So we don't know if this will help with that. We can't tell you that, but we also have a low risk. We have a low, so you would say to them if they said there was a problem with the heart, the nerves, and soreness in the mouth or in the esophagus, that you would then say, I want to do this. That's how you would think about using these. Okay.
Yeah. And they were all oral, and I'm just double checking in the note. Yes, they were all oral, 120 milligrams 3 times daily, including for that neuropathy trial, which just answering
Yeah.
a question in the
And the
chat.
reason why this dose is so standard is because I suspect, because I remember some of these studies, they probably used the German formulations, which when the Germans set the standards for what they want an herb to be, and they do a lot of research studies on it, then frequently, commercially and in research studies, they follow that lead. So when it happened with St. John's wort, when it happens like this, you're like, great. Now we can all be comparing apples and apples and apples, which is excellent. Good.
Although I do see a little comment in the chat that it's being done by one person in liquid in a tincture form. And I would actually recommend a capsule just because different constituents extract in the capsule, and they did use capsules for all of these studies.
And a rule of thumb that we've talked about is that if you either you or your provider will look at the study and then try to match what they're giving you as closely as possible to what was studied. And we don't know that liquid tincture would be bad, but we also don't have 5 studies on the liquid tincture. So it depends on how you feel about playing your odds, basically. Make choices. You may find that you tolerate that well, then okay, good. Alrighty, so that was an exciting one. I was
Yeah.
like, and every time you see it, it's like watching your hand. This is good, and this is good, and this is good. And you're yay! I can count them off.
Low, I would call it the low-hanging fruit,
Right,
or
right.
or the rapidly growing weed because
Right,
it's
right.
yeah,
Yeah.
easy.
Okay. So what else was really exciting in the meeting? What else did you really find interesting?
So the other one I thought to talk about was a new turmeric study. So I mean, turmeric is definitely a love of mine. Um,
The plant is turmeric. It's a
yeah.
yellow orange root that looks a lot like ginger. You can find it often in your grocery store, especially if it's a hippie grocery store like I go to. And it's been a foodstuff for years. It's in every curry practically that you eat. Very popular herb in India. And the extract, the main active ingredients are a set of compounds called curcuminoids, and they're bright yellow. So with that introduction, tell us about this new turmeric study.
Yes. So this new turmeric study was a dose escalation study, also a 2024 one, so nice and recent. And they picked a type of turmeric that is a little unclear in that there was a lot of capsules only providing 400 milligrams a day of curcumin, which is a low dose.
Yeah.
Given that most of the supplements that we use are around 500 milligrams of curcumin per capsule. So clearly this was a little bit more like the spice and not as concentrated as the versions that we would normally use. So you might say it was even a little bit underdosed. But what was exciting about this study is it was a randomized control trial. And it was 78 women with cervical cancer on all different stages who were going through carboplatin and paclitaxel chemotherapy. And it was looking at the safety and the effectiveness for chemo brain. They call it chemotherapy-induced cognitive impairment, but for chemo brain. And I wanted to start by saying cognitive changes are never just one thing, that we can't address from a clinical perspective, we can't address cognitive changes without also addressing sleep, right? Because when we're not sleeping habitually, it's very hard to focus. And anxiety and stress are huge
Depression too.
impairments. Yes. I mean, anyone who's had, obviously anything traumatic happen, your brain just goes offline, right? So I did want to back up and say there are many, many life.
You're talking to people who are all on active cancer care. I think
Right. So everyone gets it. Everyone gets it. But then there is this added piece that chemo causes a lot of inflammation and it makes the blood-brain barrier leaky. And so is there something physical, in other words, turmeric is the answer is yes, that will shift how cognitively impaired people are during chemo? And the answer was yes. They used actually multiple assessments in this. So they used the MoCA, which people might have been familiar with for, cognitive function and aging. They also used a test called the Stroop test. And they had an interesting timing. They did 14 days off, 14 days on and then 7 days off. I'm not really sure why they did that because sometimes they did it while you were getting chemo, and then stopped when you were off chemo. I personally would have just used it continuously, but whatever. So yeah, with these partial dosing and even with a lower dose, they had really clinically and statistically significant improvements in cognitive function, even though, interestingly enough, the self-reported perceptions didn't change. The actual,
I like that.
yeah, isn't that funny? I was surprised. Don't know why.
I don't know how to turn it off.
Thank you, Nancy. Okay.
So that was a bit unexpected, but interesting. And so the standardized tests improved. And then also the other things that were really interesting that improved were interleukin-6 levels, which is a measure of inflammation. And then they measured something I hadn't heard of before called GFAP, which is glial fibrillary acid protein, which is basically a biomarker of damage to our neurons.
Injury.
Yeah. So that was really reduced. So here we even have like some understanding of the mechanism by which turmeric is protecting against cognitive changes from chemotherapy. And again, for me, this is very, very exciting because cognitive changes are very distressing. Having, experienced it myself in chemo, they are distressing.
They don't always go away.
And they often persist. And as interventions go, again, we have an increasing number of studies of turmeric or curcumin. So sometimes turmeric powder, sometimes curcumin extracts combined with chemo. Like we had an irinotecan study looking at area under the curve to show that there weren't changes. Turmeric really does not seem to impact CYP3A4 at all. Not that all things go through it, but it doesn't go through the main pathway, which is handy.
You should pack that a little bit for people.
Yes.
So what Jen's saying is that the nice thing about this is there are ways that you can check to see if an herb and a drug affect each other. There's a very standard way that drugs get metabolized. And if the herb changes that metabolism, it will change the amount of drug. If it increases how quickly the material gets metabolized, then it lowers the level of the drug. If it, on the other hand, impairs the metabolism, the amount can go up, and if it goes too high, it becomes toxic. So you're looking to see if the herb changes how much drug is available. And the nice thing about this is another herb we have a lot of experience with, we don't have a lot of toxicity with, and finding out that these terribly dangerous interactions don't occur. So it's another, almost a free lunch, where you can get a good effect without a big cost. And that's the business of integrative oncology. Can we give you something that will take away some toxicity and not cost you something else? So I wanted them to understand, because this is a big deal. This is a really big deal.
Yeah. And I'll address one of the questions in the chat, which was, what about interactions between curcuminoids or curcumin and bleeding risk? So we do have 2 small studies looking at preoperative use of curcumin, but in pretty high doses. And it didn't affect bleeding time or INR or platelet levels. The question was about bevacizumab or Avastin in particular, and I have freely combined those and feel comfortable, but please do not include it without consulting your provider, because I'm not your provider and don't know your whole context. One thing.
It might change when your counts change. Like if you're happen to have low platelets right at your nadir or whatever, you might need to
Make a
adjust.
different decision. Yeah, because the other thing that I was going to say, and this is like the theoretical issue with most herbs are anti-inflammatory. And when you lower inflammation, you actually are on some level going to affect the clotting process, because clotting requires sticky platelets and a bunch of inflammation in order to happen. So it's all theoretical, but one has to remember that, and also remember that our bodies always want homeostasis. So even sometimes when we have very low platelets, we can clot very effectively when and where we need to clot, because there's acute damage to an area and our body knows what to do, right? So
with that, right?
yeah. So
if I could interrupt just a second, I'm super interested in the curcumins also because they're anti-inflammatory, they might lower pain levels. The drugs you're talking about in this trial are very painful to take. They
yes.
cause a lot of myalgias and
Yes.
things like
Muscle
that.
pain. I'm gonna run it simultaneous
Yeah.
translation while you 2 scientists are talking. Go
But
ahead.
I would have to, I'm super interested in taking it for the things that are hard for me. It also seems to be it seems to be helpful in ovarian cancer as some kind of cytotoxic thing. And
there are these, I don't
Yeah.
like saying that out loud because we don't have it established, but what I can tell you is happening in the research is they're taking curcumin nanoparticles and combining them with Taxol and infusing them. IV curcumin, we have 1 study in our database. I am sure we're going to start to see a lot more IV curcumin. I predict that in the next 5 years, we will see some either drug conjugate with curcumin, or just curcumin IV added as an add-on to
like as a maintenance
chemotherapeutics.
therapy and something that helps with pain, I think it has, a lot of potential. But I guess my question for you all is I don't have an integrative oncologist and I don't know one in San Diego.
Go to the no provider network. You will definitely find California has some
A lot of people.
fab knows.
And Andrew, you can write to Cancer Choices and we'll help you. We have
Okay.
Because
Because my doctors are very good people, but they will give me that blank look.
and
Yeah.
that's
Yeah.
so we're
They-
gonna move on from a personal question, but you
And actually,
Okay.
maybe at the end, stick on the end, because I know some of the people in California, so I can give you a couple of names, if not in San Diego, at least in California.
not recorded when we're
Yeah.
not being recorded. Okay.
Yeah.
Right.
Thanks for
The
popping
other
in.
thing, the other things I was just going to say about curcumin that we already know, is that aside from being anti-inflammatory, from the non-cancer world, we have a ton of studies on it for osteoarthritis of the knees, which welcome to age,
Right.
who doesn't have that? We have a trial as an add-on to antidepressants to make antidepressants more effective. Again, there is a connection between inflammation and depression, mood, obviously. Our system is more prone to depression. We also have one study on it improving bone density in postmenopausal women, which is really interesting. And that study was short. That was a 3-month intervention. I couldn't believe they saw such a difference. So all that to say that, there's other fringe benefits to curcumin. So I was so happy to see this trial because it's very clinically significant. It's something that I want to use anyways because it has tons of anti-cancer potential. And
Some studies too.
yeah. And oh, I mean, the research on curcumin just is
Pretty big.
mushrooming.
One
Sorry.
person asked about a curcumin or turmeric tea. This brings up the issue of why this should be sourced and prepared and given as more like a phytomedicine than a home remedy. Curcumin is not very soluble in either water or actually even in alcohol. So to be able to get it into the body, usually curcumin is either attached to something or there's something else in the formulation. So when you pick your curcumin or your turmeric, not plain root, but you should get a product that takes that into account. Okay.
Yeah, I was going to say, like, there's also the fat soluble, the curcumin phytosome is the most researched in the KNOW database. That has the most studies on it, but there's C3 curcumin, there's curcumin with bioperine, which I'm a little more nervous about because of drug interactions, but it depends on the context. And then there is one called theracurmin, which is a water-soluble turmeric, and that they did a 2-year trial on for cognitive function and aging, and they found less amyloid plaques with that form. So I will also sometimes use that form for kids because it's water soluble, so it will dissolve, and it's, again, for people who can't swallow. That's another thought.
Yeah, sometimes you have to make adjustments. Okay.
Yep.
So turmeric, excellent, a long historical use, good safety record. And some things this is something that has been tested and we know doesn't have interactions rather than we don't think it doesn't have interactions. This we know doesn't have interactions. Therefore, I think another thing to think about talking to your clinician about, especially as a preventative agent. Excellent.
I will say there are case reports and they're very rare, but of an autoimmune hepatitis with turmeric. The only reason I mention it is one of those case reports comes from University of Michigan, which is I'm
You're
in
next,
Michigan. So I get a lot of pushback from the oncology teams there because they've become frightened about it. But rest assured, we have a systematic review that it consistently reduces liver enzymes in non-alcoholic fatty liver disease. This is a liver protective herb also.
Right. Again, like this one, and since the liver gets really beat up in traditional cancer care, we really want to make sure whatever we give doesn't have that potential because it's likely to be doubling up on something. So great, good. Okay, so that's an interesting one. But many people are changing out of the tough, basically things like Taxol and all that kind of stuff. They're out of the basic chemotherapy drugs into immunologics. Did you hear anything good about that at the conference? Because more people are migrating over to that.
Yeah, we had two studies that we talked about as a group. This was Lise Alschuler and Tina Kazor who did these presentations. They were fantastic. They always are. They do these 2-part research updates that are really fun and insightful. So one of the studies was it was a systematic review, looking at time of day and outcomes in immunotherapy. So they found 13 studies with 1,663 patients, although those studies were all retrospective studies, which is all we have really. We're having to go off of these in the immunotherapy world. We have to accept that.
So you're looking back, instead of looking forward, you're looking back, so you don't control how things were done. That's what that means. And you're looking at the time of day when the material was given.
Yeah. And there was a very clear, strong association between getting your immunotherapy in the morning or anytime before 12, 1 o'clock and having better overall survival. And, there's lots of theories about the immune system and the circadian timing. They dug down into some of the individual studies, one in gastric, which was just basically showing the same thing, which is that if it's at all possible to time immunotherapy in the morning, you may really get
A much better outcome.
better responses, better outcome, better survival, which is, we're all trying to
Name of the game.
maximize that. Yeah. Yeah.
It's
So,
such a simple intervention, such a simple intervention.
yeah.
Really.
And then the other one we talked about briefly, although I have a little hesitation bringing it up, that was a melanoma study looking at immunotherapy and pre-treating emotional distress. And what I like about it is we should always be treating emotional distress in cancer care because distress is universal and it has such an impact on quality of life, on sleep, on immune function, on all of it. So, but I also hesitated to share this one just because I want to be really clear. This is not about blame. This is about our healthcare system needing to meet the needs of cancer patients, us. Yeah, people living with cancer. So, anyway, so what they found was that they had better recurrence-free survival and distant-free survival if you aggressively treated. So again, my take home from this is psychology matters. I believe that to be true always. Mindset matters, and we'll loop into the guided imagery a little later, but any ways we can find to modulate our stress response and bring ourselves into a relaxation response is going to be beneficial for our immune system, for our cancer process, all of it. So, and then
what I'd like to touch on, because this is going to be probably the last thing we're going to do before we're going to do the relaxation, which is a lovely gift, and I really want to give that to everybody. I don't want you to feel rushed. I have been reading some papers, and I wonder if you discussed these at the conference, about how immunologics are very dependent on what's happening in the gut, like how robust, how varied, how non-bad actors, what does your gut microbiota look like? Who's in there? And are you supporting them? And so I've read some studies just saying taking fiber, plain old, just nothing fancy fiber, made immunologics, which are tens of thousands of dollars, work better. And I like it when it's a quick, simple hack that's inexpensive and very effective and safe,
Yeah. Thank you. Thank you for bringing that up. The microbiome seems to be the microbiome is our gut bacteria. So the state of our gut bacteria, which I will say our largest immune organ lines our intestines, the gut-associated lymph tissue. And so the gut bacteria do a lot of talking to our immune system and really help shape and drive the decision for an autoimmune reaction or non-autoimmune reaction. And in the world of immunotherapy,
the body acting against itself, not being able to tell self from a harmful intruder, for example.
Yeah. And because the really harsh side effects of the immunotherapies are autoimmune adverse events, they're called, or autoimmune problems, the gut is a big area to focus on when you are doing it. I will say there are 2 trials of a Japanese probiotic called Clostridium butyricum, both showing better overall survival in the group that used that versus not. One was a retrospective study, but one was actually a prospective study. So that was
That's
exciting.
quite interesting. I don't know that that's available commercially yet.
It's there are even on Foldscripts there's a C
Huh?
butyricum.
Huh.
I think the reason why butyricum works, this is just my theory, keep
Fine.
that in mind. So butyric, this bacteria produces a lot of butyrate. Butyrate is a short chain fatty acid that feeds other bacteria.
Good bacteria, the good
So
bacteria.
basically, this probiotic creates microbial diversity.
Mhm.
So
Which is the
also,
name of the game. That's
which
what you
is the
want.
name of the game. Our goal, and I love this, is creating diversity. That's our goal, which is what fiber
United,
is.
the
Yeah,
United Nations of your intestine.
exactly. Exactly. So, I actually think that the diet is much more impactful than a probiotic, but you can certainly do both
You
safely,
do
which is,
both. You could,
yeah,
yeah, you could
yeah,
take a very easy, eat oatmeal, take a fiber, psyllium, and it doesn't have to be super fancy, which is, I think, the most ironic, God is laughing because here we made this hugely technologic immunological therapy. It's gazillions of dollars and simple things improve the efficacy. That's just
yeah.
delightful.
The
Yeah,
only other thing I wanted to mention that improves the efficacy, well, not doesn't improve the efficacy, but might reduce the risk of colitis is
yeah,
vitamin D. Yeah. So
yeah,
vitamin
vitamin D.
D
Okay.
supplementation is associated, this is again retrospective study, but is associated with a lower risk of having the colitis. And colitis is the most common side effect we see with immunotherapies usually. And
That limits continuation of use especially. So,
ooh, Laura, look at this great.
this
I
reminds,
haven't seen this one. I can't wait to see this website. Okay, I get to, I need to keep the chat afterwards to look at
right,
all
right,
of
right.
Laura's
We will keep
juicy
the chat. And
pearls.
I usually write everything up and send out all the good stuff that's in the chat.
That's awesome.
It's a thing I forgot to tell you guys at the beginning, but as we're going through, keep an eye on the chat because our wonderful Laura is putting in links back to the Cancer Choices where we have information for you, other resources that could be useful. So I will write this up and send out all the information so you guys can see what the goodies that are in the chat if you don't get to watch them while we're doing them. So Dr. Green, any other hot news flashes before we decide to close this call with a nice bit of peace and gentle love from you?
No, no. So I was gonna ask, I can certainly make one up on the spot, but we could also play one of the guided imageries that has theta music in the background.
Oh, that's
That's
nice.
from the album. So I recorded an album called Beloved, Guided Imagery for Cancer. It's free. It's on Spotify. It's on YouTube. Although when you listen to YouTube, it interrupts with commercials unless you have the
Yeah,
ad
which I
free.
hate that. Yeah.
I know it's super annoying, especially for the sleep one. Like that one's where so Amazon, Spotify, and YouTube. It's on, and I think Laura, thank you if you can put my belovedcancercare.com link in the chat. You can access it there. So I was gonna see if Mary, if you thought we should do I have affirmations, which
Those are
are
nice too.
yeah, we could do affirmations for successfully navigating cancer, just to,
Uh-huh.
because
That's a
that's
good one.
kind of general, and we are all navigating cancer. So,
One or the other. So I usually like to let the group have a vote on that. So
yeah.
so you guys can either put up your little thumb from the bottom part of the screen where it says react, there's a little heart. So I'm going to give you a little choice. Would you rather do affirmations, which are loving messages telling yourself a positive outcome? So that's one, that's number one. And number two is going to be that generally either play a full relaxation for 10 minutes or so. So option one, put up your thumbs now if you want that. Or you can show me your hand. Thank you, Yin. You got the whole thing. Okay, let's see. I have to look at both. I have to look at both screens. Okay, that didn't seem like it was a big, exciting thing. Okay, so most people, I think, are going to want the second. Let's confirm this. So you want to have a real relaxation for 5 or so minutes or something. Show me your thumbs. Thank you, Henry. I see you. Okay. Well, this is not a voting audience today. What can I tell you? So,
Okay.
oh no, here come my thumbs. Everybody, I think everybody would rather do that. So,
So play a little breathing relaxation and then affirmations after?
why not? If we have time,
Okay.
we could do both.
Or,
Good.
or the other one, yeah, great. We'll do that. Or yeah, great.
Wait, I was saying,
I
don't,
got distracted because I have one called Connecting with Your Inner Healer that I thought
that's I
might,
love. But now that you've shown us here, we can absolutely find those and pursue those.
exactly.
We've talked about we've talked about guided imagery, and I've sent out one of our emails where we've had some resources, but this is just fantastic. So I
Yeah.
really want people to go back and dig through them all.
So,
Okay.
Jen,
Yeah.
do you know how to optimize for audio and video? Or do you want me to share it or?
Could you share if you, I don't know how to optimize. I'm not very good at Zoom. I was just going to play it on Spotify and hope that it piped through, which might have
Yeah.
been a pipe dream actually.
Yes, it could have been a pipe dream. So which one do you want me to play?
Could you do the Inner Healer guided imagery?
Yeah, the visualization, not the
Yeah.
number 12.
Yes. Let's see.
Okay,
Let's see.
let's see. I don't want the free trial. Okay, I think, so give me a moment. I think
Okay,
I can
thank you
do
for
this. I think I
Turn
can
on
do
the
it.
original sound for musicians in the
Right,
upper right. Okay.
yes, and then there's something you have to optimize. So yeah, and I've got
And while Laura's doing that, I'll take a moment just to say that there is a fair amount of research on guided imagery in cancer patients. We have one in breast cancer where women's natural killer cells were higher, who visualized their natural killer cells vividly. We have one that saved $750 in surgical time by doing 3 guided imageries 2 weeks before surgery, just visualizing a smooth surgery. So there's a surgery guided imagery, of course, that I recorded on it. There's been quite a number on managing nausea with chemotherapy and also fatigue. So, we think of guided imagery as this soft therapy that doesn't stop it from being effective. So, I'm just really a fan because you can't hurt yourself with it. It's cheap, it's free, it's something you can put and go and Lord knows you spend enough time in waiting rooms or in chairs when you're going through cancer treatments where you have time and you've got your phone with you so you can put your earphones in and be transported to another place, a healing space, a place of relaxation and calm, and a place where we can reset the nervous system. So
Okay, and Jen, is this the right one up here?
yep, that's the right
And that
one.
one's 19 minutes.
Yeah, it's not going to be that long. There's a bunch at the end. Yeah.
Okay,
Yeah.
and let's test it and make sure you can
Let's
hear
see
it.
if
I'm going
let's
to
see if
turn
it
it on
works.
right now and let me know.
To
Oh, that's
begin,
perfect.
take
Perfect.
a moment to settle in comfortably and take a few deep, calming breaths. The physiologic sigh is a type of breath where you inhale slowly through your nose, take a sniff of extra air to fully expand your lungs, and then exhale and release through your mouth. In studies, the physiologic sigh was even more effective than meditation for creating calm and resetting the balance in your nervous system. Let's take a moment to reset together. I embrace myself wholeheartedly and dedicate myself to being a kind and gentle friend to myself along this healing journey. Part of my job now is to rest, rejuvenate, and restore my health. I am able to set clear boundaries in order to care for myself. I am capable, strong, and naturally resilient. I can handle whatever comes my way. More and more, I accept what I cannot control and trust the bigger picture. I cultivate my own inner peace and calm so that I make wise choices for my own well-being. I call upon my intention to heal my physical body, my emotional body, and my spiritual body. I engage my powerful will to assist me in doing this. I instruct my body to reset back to its original healthy genetic code, which is vital, healthy, strong. I can feel it as I hear these words: vital, healthy, strong. I am grateful for the fear which arises to alert me when something is unsafe. I can use the fear to fuel my actions and my commitment to keeping myself safe. I can also source these actions and this commitment from my own inner sense of peace and calm. More and more, I am able to be tender, compassionate, and kind to myself. I am able to deeply listen to myself, paying attention to signs and messages coming from my own inner wisdom. I invite assistance from my friends, loved ones, as well as the plants, trees, and nature all around me to lend me their support and strength. I sense myself surrounded by their love and care, and I feel the warmth of their kindness spread gently through my body. I see myself surrounded by ancestors, guardian angels, and with God's healing presence during my treatment. I feel them watching over my body and blessing me with unconditional love. I see myself surrounded by capable, caring staff during my treatment, working with kind competence to ensure my well-being. I thank the medicine and procedures designed to reinforce my body's natural ability to heal itself, and I join my strength and purpose to theirs. As my time in treatment unfolds, I am able to adjust and adapt. Adjust and adapt. I am flexible and resilient as I move through my medical care. I know there are some moments when I feel sad, fearful, or angry, and I accept and allow what I feel as my inner truth of the moment. I offer myself compassion and understanding for what I feel. More and more, I can soften and let go of unrealistic demands and rigid expectations of myself and others. I know that when I forgive myself and others for mistakes of the past, I am helping myself to heal. I love and appreciate myself, take time to care for myself, and am a clear advocate for myself. I give myself the time and space I need to heal. I find joy, courage, and grace in moments throughout my day. Like gathering flowers in a meadow, I gather loving kindness and self-compassion and place them in my body, feeling them fill my arms and legs, my belly, chest, and head. Ah, very good. Yes, yes. When I go to sleep, I instruct my body to continue healing itself at an even higher intensity than in my waking state. My powerful immune system is actively scavenging for cancer cells. My sleep is restful, restorative, and deeply healing. I sense my body following these instructions. When I exercise, I activate my immune system and my resilience. My body becomes energized and infused with joy, self-expression, and purpose. I can see my powerful immune system coursing through me, recognizing and eliminating any chaotic cancer cells that do not belong. My white blood cells are circulating through every part of my body. I see them increasing in number and strength. They are strong and capable, wise and discerning. I see my white blood cells clearly identifying chaotic cells and melting them away. I sense my whole immune system working together, effectively doing its job. It is cancer's time to leave and be gone for good. I see myself receiving effective treatment that successfully goes exactly where it needs to go, doing exactly what it is meant to do, with minimal side effects and very little discomfort. I see myself recovering quickly and efficiently, my body comfortable and safe. More and more, I feel my soft and grateful heart stay open even in the face of discomfort. I see soothing, warm waves of water cascading down my body, softening sore, tense, or tight places, and dissolving any discomfort or distress. I can notice any discomfort as an observer from a distance. I can lean into small sensations of pleasure in my body. I can place firm boundaries around suffering so that there is expansive room to feel delight, joy, and wonder. I am in solidarity with myself. I thank my body for its loyalty to me, my companion, carrying me as I learn and grow. I thank my grateful heart for staying soft and open. I salute my spirit, which is unending and pure, and part of the infinite beauty of creation. I recognize and cherish my individuality. I know I have been given unique gifts to share with the world, that I am inherently worthy and have divine purposes to fulfill. I cultivate thoughts, speech, and actions that bring healing and well-being both to myself and others. More and more, I can sense that there are blessings in my challenges. These circumstances are guiding me to discover even greater courage, strength, and meaning in my life. I know that whenever I need to, I can take some calming breaths and safely rest in the hands of the divine.
Would like to be able to thank Dr. Green for joining us today, for sharing her amazing knowledge with us and the gift of this lovely this lovely resource that we're all going to have a lot of healing and just wonderful experience with. So on many levels, Dr. Green, Jen, to those of us who really love you, thank you from the bottom of my heart. I appreciate you spend the time with us. I love that you shared with us. We're all going to be on the newsletter. We'll do our 2-week trial when the time is right. And we're going to have you back another time because it's just so much fun to talk with you. So
Thank
from all of us here, I really appreciate you.
Thank
Thank
you
you.
so much. Oh, thank you.